Good morning, Mr. and Mrs. Wilson. My name is Scott Topping, and I am the registered nurse that's been assigned to your son David. As I understand it, David is being discharged to your home, and you will be taking care of all of his daily needs, as David has suffered an anoxic brain injury. This is one of the most important health and well-being tasks that you'll be undertaking, as it ensures that David's nutritional needs are consistently met. The feeding formula has been prescribed by David's primary physician and in consultation with a clinical dietitian. It's important that the prescription dose and frequency be strictly adhered to, and if there are any problems, you should contact our office as soon as possible. I was asked to familiarize you both with the procedures that will be required to feed David through his gastrostomy tube, so that both of you can feel confident in your abilities, as well as to keep David safe and healthy. The method I will be showing you is known as the bolus method. By utilizing a syringe, you can accurately measure the amount of formula being given and dispense it in a controlled manner via the plunger. The bolus is in direct reference to one meal as prescribed for David's needs. So, here we go. Step 1, wash your hands. I know that after the last 2 years, we're sick of someone telling us to wash our hands, but this is extremely important in preventing cross-contamination of the formula and will help to prevent any additional illness to David. Hands should be washed with warm water and soap for at least 20 seconds while making sure to include nail beds and the webs and base of fingers. I always wash my hands and sing happy birthday to myself twice. Just don't sing it out loud in front of people, it just makes you look kind of weird. If you're using an alcohol-based hand sanitizer, please ensure that you are covering all of your hands, nails, and wrists. Make sure to rub your hands together until they are dry. Step 2, get all of the supplies you will need ready. Nothing is worse than having to stop what you're doing because your equipment isn't in place when you need it to be. Keep it in an area with enough space to be comfortable. All your supplies together. Some of the things you will need are the formula, an empty container, cup, a clean cloth, a container of drinkable water, and a 60 milliliter legacy catheter tip syringe, and in some cases, medical tape might be of benefit to you. Step 3, open the plug at the end of the feeding tube. Step 4, fill the syringe with water to the recommended amount that has been specified by David's primary physician. Place the syringe end into the now open feeding tube, unclamp the feeding tube, and push the plunger gently and slowly to flush David's feeding tube. Step 6, reclamp the feeding tube, remove the syringe. Step 7, wipe the top of the formula container with a clean cloth and pour the formula into that clean open container. Excuse me. Then you fill the syringe with formula and note the amount carefully. Step 8, insert the syringe back into the feeding tube opening and ensure that the catheter tip is secure. You can use that piece of medical tape to make sure that the syringe does not disconnect from the feeding tube. Step 9, unclamp the feeding tube and gently press the plunger until the syringe is empty. Then reclamp the feeding tube. Step 10, disconnect the syringe and repeat steps 7 through 9 until the total amount that has been prescribed for David has been reached. This process should take about 15 minutes or so. Step 11, after the full amount of prescribed formula is given, now you will fill the syringe again with drinkable water as was prescribed, unclamp the feeding tube, flush the tube slowly, reclamp the feeding tube, and disconnect the syringe. Lastly, step 12, it's cleanup time. Take apart the syringe and clean thoroughly along with all reusable equipment. Mr. and Mrs. Wilson, these are the steps that you will take for each bolus feeding. There are a few things we would like you to keep a watchful eye out for. We want you to call in immediately if you observe any of the following in regards to David. If at the insertion site there is any bleeding, pus, redness, or swelling. Report any changes in bowel function, such as no bowel movement in more than 2 days, constipation, or any significant changes in bowels. Change in color of urine or its smell. Noted weight gain of more than 5 pounds in a week, or loss of 2 pounds in a week. Any noticeable or unusual swelling in the abdomen, feet, legs, hands, or arms. Any vomiting, diarrhea, fevers greater than 100.4 degrees Fahrenheit, or shortness of breath, are all concerns that must be relayed immediately. So this is a lot of information, and we are throwing at you pretty fast. I'll be giving you a few copies of the steps, and one is laminated so you can keep it close by when preparing for the feedings. Just make sure you keep it clean and not directly in the formula preparation area. Don't think of this as the end of our support for you both, as well as for David. It's just the beginning. We are here to answer any questions you may have, and together we will work to give David a healthy and safe care. Do you have any questions? Great. Have a great day.